Welcome to Shift Report, the podcast brought to you by mcentric.com. mcentric is the go-to information and resources hub designed exclusively for the emergency medicine community. On each episode of Shift Report, we host key leaders from the field who share their insights and experience from inside the world of emergency medicine. Our goal is to inform you, to encourage you to use what you learn to improve your practice and to improve yourself. Today, we welcome Riva Kamat. Dr. Kamat is the CEO and founder of Lotus Clinician Wellbeing, a company that improves the retention of clinician staff and decreases burnout in clinicians. She's a practicing pediatric hospitalist in Northern Virginia. She received a medical degree from Meharry Medical College and trained in pediatrics at Women and Children's Hospital of Buffalo. Today, she'll focus on physician well-being, an important area for which she provides services to individuals and groups in the increasingly difficult medical practice environment, while sharing some insights on how she manages the hectic mix of clinical and non-clinical roles we know so well. Welcome, Riva.
Thank you so much, Till.
Thanks for taking the time to share some insights with us today. Like many of our listeners, you have a wide range of experience in medicine, which led you to some of the areas we'll discuss today. So kind of backing up to medical training, what led you to pediatrics as a specialty area?
Yeah, it was really my love for children, this sort of passion for working with kids, knowing that pediatricians make a positive impact on the child's development and their well-being led me to pediatrics. It's also a huge source of personal satisfaction for me. We have very interactions with pediatricians and families. They also provide us a slew of diverse medical challenges, and knowing from a preventative medicine standpoint, pediatricians can make a long-term impact.
That's great. And I think we all have our reasons for going into our various specialties. And, with or without families, we all realize how important pediatricians are in our development. And many of us probably recall our own pediatricians as leaders for us.
That's right.
So all of us had mentors and people that guided us along the way, either into medicine or during training or beyond. Who are some of the key mentors you had, and how do they lead you to where you are today?
I think my key mentor was my mom, actually. She helped me sort of develop a career path. She helped me develop a sense of purpose and who I am. And then along the way, the second key mentor were two physicians that I met as I was growing up, and I shadowed them. I saw what they were doing in their own practice as pediatricians, and they helped sort of shape my vision of what pediatrics looks like.
Yeah, that's a common thing we hear from many of our colleagues about before they trained and then while they trained, the important people in their lives, so especially people's moms, who frequently come up as role models. You work as a pediatric hospitalist, which is challenging in itself, but you also provide physician coaching through Lotus Clinician Wellbeing. What got you interested in this area?
So I've always been very interested in the well-being of our clinical staff. And while I absolutely believe I absolutely believe patient care comes first, our well-being has to be in the mix as well. And oftentimes our well-being, our self-care is put on the back burner. And, you saw this definitely well before the pandemic, but during the pandemic, physician burnout came to the forefront, and we're still experiencing physician burnout. And so this has always sort of been a topic for me that has been quite passionate. And now I feel like people are taking notice that we really have to take physician well-being and other clinician well-being seriously, when we're discussing the long-term viability of careers in medicine.
So I think you've touched on and identified a problem that many physicians and other healthcare workers, frankly, feel, and clearly felt this is not just a COVID phenomenon. This clearly started well before that. But how did you learn to be a physician coach? It's not a natural skill that everyone has.
Yeah, I was, so I've always been very compassionate and empathetic to others. And I was looking for an evidence-based strategy to help other physicians with their well-being. Um, and I came across several people who were in this space of doing physician coaching, and I decided to go ahead and complete a certification program. I also worked with a coach who was wonderful, and she taught me a lot about self-care, and she taught me a lot about self-compassion. And so that was a wonderful path to move forward with physician coaching.
So you work with clients, largely physicians, groups, individuals, I assume in multiple ways. So in working with them, what do you find as the top challenges they're facing, and how do you help them through this?
Yeah, there's usually two categories. There's the individual category, and then there's the organizational categories. So the individual categories really include people not having enough time for self-care, not taking vacations, trying to achieve some type of work-life balance, especially times of when moms are becoming new moms and finding out they have a tremendous amount of mom guilt when they're trying to work and trying to take care of their own children. They have so many issues with, people have issues with time management strategies. Then the second category includes those organizational strategies such as the excessive use of the electronic medical record, where we find that it is everywhere. Unfortunately, like even when you go home, you have access to the EMR. So at 2 o'clock in the morning, people are doing pajama rounds, meaning they're on their computer and trying to get their documentation done. So the organizational support is really important during time, thinking about how we can talk about looking at burnout.
Yeah, and I think anyone listening to this, myself included, here's the list of things you mentioned, and probably can identify many of them within themselves, and perhaps trying to deny it, but then recognizing, oh yes, this applies to me also. So that's clearly an important service you provide. So um, we've all heard about burnout, and there are likely multiple definitions of burnout, but it's something that is discussed openly in the popular press, in the literature, in break rooms, in hospitals all over. How can physicians and anybody in healthcare, because this applies to nurses and just about anybody that works in a healthcare environment, avoid burnout and deal with the causes?
Yeah. So that's a really great question, Till. I mean, I think one is being very intentional about your how you work, and also understanding that you have to take care of your personal health. And personal health includes doing those things that we know are really good for us, getting outside in nature, um, managing our emotional health using, whether it's using mindfulness techniques, meditation techniques, engaging in your creative pursuits, whether those be certain hobbies that you might have left on that back burner because you're so busy with work, or you're exhausted from work and you can't work out. So finding that time, being intentional, setting a schedule, eating healthy, getting enough sleep. Sleep is huge. We know that that's a huge contributor for our personal well-being.
So that those are all great pieces of advice. physicians are not the only people that work in stressful environments. We can think of colleagues that we see every day, law enforcement, fire and EMS, and other people in stressful jobs. So how can anyone, physicians or otherwise, better deal with stress and avoid burnout?
Yeah, great question. So have a plan, and have an intentional plan. One is, again, looking at your physical health, maintaining a healthy diet, maintaining good sleep hygiene, going to bed on time, not necessarily doom scrolling on the internet or social media, um, engaging in those creative pursuits that you enjoy. People enjoy walking or hiking, getting into nature. Sometimes people don't take their vacations, especially in the physician clinician community. They don't take vacations because they feel they don't want to burden their colleagues. And I would say, take your vacations, take time for yourself, take time off, take those self-care days for yourself.
Very important advice. So you practice clinically as which is quite admirable. Many of our physician colleagues are have left clinical practice, but you work in a very important role as a pediatric hospitalist, and thus have a unique perspective on the emergency department, because many of your patients come from the emergency department, have been managed in the emergency department, perhaps have lingered in the emergency department too long because of all sorts of supply and demand issues. So in speaking with the public, what do you have to tell and inform the public about the challenges facing emergency departments today, and in your case, particularly pediatric emergency departments?
Yeah. So I would say there are so many multiple issues that are affecting our ERs today. One of them is the overcrowding and long wait times. There's larger patient volumes, especially for pediatrics in the wintertime. There are resource limitations that the public should understand. Many EDs in this country are short-staffed. We have a decrease of our nurses are leaving just generally. Sometimes, and many times actually, there is a very high stress level, as you know, in the emergency room, a high stress environment. And we want people to understand and sort of understand that while emergency room doctors and clinicians and PAs and NPs are taking care of them, they're also taking care of multiple other people as well. So it's important that people understand that they're not the only patient in the ER, so to bring their patients with them too.
Thank you. So you also deal with patients and parents and other family members who have come to the hospital, sometimes unexpectedly, sometimes for repeated care. So in your management of a very important patient set, what do you want members of the public to know about when they visit the hospital? What do they bring with them? What questions to ask? And how do they manage an interaction with a hospital environment with which we're very familiar?
Yeah. So I want them to know that we're going to take really good care of you. And the way that we can provide the best care is for them to bring very clear, honest, accurate information. And so it's important to provide very detailed information to your healthcare provider. So what medications you're on. So bring your list of medications, provide a clear medical history, bring your questions, bring all of those doctors' names that you have been with, provide a clear description of your symptoms. Also, be very transparent in what medications you're on, if you have any allergies, if you've had prior treatments, what follow-up visits. And secondly, I'd like to say that patients should be their biggest advocates for their children or even for their children. So we want you to actively participate in the care that we're giving to your child or to your, to your teen, if that's the case. And also bring mutual respect. We are human beings. We are not gods. We want to be able to help you, but we don't always have all of the answers. And so there needs to be a mutual respect. And I also would like to just bring in the issue of increased violence in our emergency rooms and in our hospital systems. And so it's really important for people to, I think, bring their sense of patience and their sense of calm when they come into an emergency room, because we are all trying to do the very best for your child.
You mentioned a number of issues, each one of which could have a 30 to 60 minute discussion devoted to it, and perhaps we'll come back to that another day. So you've given us a lot of interesting points, and you clearly work with a lot of providers about their stressful lives professionally. We in emergency medicine, much like other specialists, have chosen a stressful environment in which to work. So what general advice can you give to emergency providers about taking care of themselves in that environment?
Yeah, I think, the biggest thing right now is just being very intentional about your individual well-being, and then also looking at your organizational well-being. So, we talked a little bit earlier in this podcast about the individual well-being, being your physical health, your mental health, seeking out support systems, and then the organizational piece, looking at the electronic medical record, looking at what resources your organization can provide. Sometimes there are counselors, sometimes physician coaches. There are oftentimes many services that your organizations do provide. And so really kind of taking advantage of that. And we need to sort of avoid that stress of, oh, I'm going to seek counseling. What are people going to say, etc. So it's really important to know that, again, we're human beings. We are having a human experience. We do need mental health care services for ourselves during this very stressful time. And we are in very stressful positions. And so managing that stress will help us in the longevity of our careers.
This has been a great discussion, and as I said, we could probably go on for hours and provide assistance in many ways to many listeners. Please remind us again how we can find out more about what you do at Lotus.
Yeah, so I provide coaching programs to medical organizations and individual coaching to medical organizations as well, individual coaching to their clinicians. And that includes physicians, physician assistants, nurse practitioners, even our nursing teams. People can find me on my website, Lotus Clinician Wellbeing. Just Google that, Lotus Clinician Wellbeing, or they can call my office number at 202-630-2470. So that's 202-630-2470. And I thank you, Till, for really highlighting the issue of clinician well-being, because it's so important that we take care of ourselves and we bring the spotlight onto clinicians who are trying to help others, but also wanting to thrive themselves in a stressful profession.
Thank you for joining us in this installment of our M-Centric podcast series, and special thanks to Dr. Riva Kamat for sharing her important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.com. Thank you, Riva.
Thank you so much, Till. Thank you. It's been a pleasure.